Hey guys, welcome back. We're discussing the medical emergencies and for the elderly, and let's get on to substance abuse and elderly abuse. We're going to talk about those things to finish this up. And I think that it's important to understand that we're talking about the toxicological emergencies last time, and a kind of a little review. Remember that they don't process meds as effectively, and you can get a lot of adverse side effects from your from your treatment if they're taking analgesics. Matter of fact, remember lidocaine, like we cut in half because because they don't process it like they should. Okay, and and it alters pain receptors, by the way, and doesn't really change the condition. Um, Corticosteroids, when the guys use it, usually they use it to treat rheumatoid arthritis and inflammatory conditions. Problem is, it shoots the blood pressure up. It causes blood sugars to go through the roof. If you got a glaucoma, that increases the pressure there, increases the risk of infections, and again, all of these things are really bad for an older person. Again, substance abuses. They're just as susceptible as a regular person. The problem is they may have a little bit different effect. Again, remember that you might have them where they have malnutrition patient, multiple prescriptions. They moving from a loved house. From a beloved house to a smaller place or an apartment because they can't literally take care of the bigger house anymore. So all of these things can lead to substance abuse problems. It could be drugs, alcohol, or both, and it could be again, it could be pharmacological. Again, alcohol. And remember, now you're going to start getting these weird, crazy interactions with them. They've already got a decreased vision and hearing. They've already got drowsiness. They've already got these symptoms already, and then we add substance abuse, which makes them even worse. And then again, the signs and symptoms you're going to get again is the same for regular substance abuse patients. Again, they're going to be probably exacerbated. Again, your alcohol abuse, and one of the biggest problems is you get organ dysfunction, which makes them more susceptible to the effects of the alcohol. Okay, and by the way, it can actually interfere with drug therapy, or worse yet, it can combine with the drug therapy that they're already doing, which causes a lot more. Okay, again, the substance abuse for alcohol really hasn't changed there. Don't judge. Again, evaluate the need for the fluid therapy. Again, usually you can. They're usually in a dehydrated state. They could be in a withdrawal state. By the way, they decide to give it up, and then of course the physical effects from that. Um, Behavioral and psychological issues that they may have. Again, there might be an intellectual decline as well as an emotional reason for all of this. And again, a lot of these older folks are isolated, they're lonely, they've lost their self-dependence, and they lose strength, and their fear of failure, fearing of being a burden to their friends or family. Very, very real things that's going to happen with these folks. Again, they can get depressed, they can get a dissociative disorder. Again, there could be organic reasons, again, where they start making things up. Again, they have become a dependent personality. They have to have somebody with them there at all times. Okay, they can have lapses in memory. Fear of death is a very real thing. Changes in sexual interest. Hopefully, not changes in sexual interest, but they may or may not be involved in that. I would say that there's no sexual interest, but if you've ever seen the loofahs down at the villages, you will think twice about that. So again, depression, sadness, despair, and unfortunately, the depression can lead to the suicidal problems. They may actually develop hypochondria syndrome, where every little thing, well, now they need to go to the hospital, especially if they're lonely and they're by themselves. The ambulance ride might be the only way for them to get out of the house for a short period of time. Yes, there are patients of ours that actually do that. Suicide rates is the highest in the U.S. in men over the age of 65. Okay, 20% of all in the elderly, 20% of all suicides again, their death reasons is a suicide. Okay, they may be doing it because of bereavement. They just lost a loved one, a family history of suicides, and again, a family issues that they may be having with that. Okay, don't forget about again. Yes, they're all rich. All old people are not rich people. Okay, they may feel isolated, lonely. Living in a youth-oriented society can cause problems. They're physical, actual reasons for them becoming depressed or suicidal. Okay, they've engaged in substance abuse. They have unrelieved pain. And again, usually the behavior is related to a stress incident. Okay, so again, breaking from medicine or the exercise routine and grieving personal loss are big reasons for them being suicidal. Uh, again, a lot of these folks don't want to be a burden on their families or friends. Okay, so they feel useless and they start stockpiling medicines. And what they do is then they take a whole bunch of the medicines and in an attempt to kill themselves. Okay, so again, gain access to law enforcement as you need them. Do not rule out firearm use. And the thing I want to stress here, a lot of old people usually have a gun. Okay, so keep that very in the forefront of your mind, especially if you're going to elderly patients that's suicidal. And literally they believe at that point that they have nothing to lose. Okay, either them or, by the way, their caregivers. Okay, one of the few times I've been held at gunpoint was a husband that wanted us to take his wife to the hospital. The wife was adamant about she didn't want to go. He was adamant that he did, and the stub-nosed 38 overruled the legal system until we got plenty of law enforcement there to take the gun away from the guy. Okay, you don't want to leave a suicidal patient alone, and again, transport these. If they're suicidal, they go to the hospital. Period. Okay. If they don't go to the hospital, they're going with a police officer via the Baker Act. And I think anybody that's been to the local mental health facilities, probably the older, the going out to the centers, I think it takes a different type of treatment for these folks. Okay. And is the regular mental health facility the place to be? I'm not quite sure about that one. Do they need psychiatric help and evaluation? That part I absolutely 1000 agree. Trauma in the elderly. Remember, they're usually on blood thinners. Okay, they're usually it's a leading cause. Traumatic deaths. That's why over the age of 55, guys, is a one blue on the trauma alert, especially when involved in a car crash or a fall. Okay, so keep that in mind. All right, this because they don't heal the way that normally we do. They have diminished eyesight and hearing. This is why they end up getting into a traumatic situation in the first place. Okay, again, if they're osteoporotic, if they have a decreased respiratory function, they can't feel their feet or their legs. They're all using anticoagulant medicine. If they're on anticoagulants and they bump their head, they get an ambulance ride. Period. Okay, guys, if you don't do that, that's when you come back 12 hours later and they're dead from the subdural hematoma because you didn't go and get them CAT scanned. Okay, if it was bad enough where they bumped their head, they really need to go. Okay, again, in your general assessment, you got to determine the mechanism of injury, check their blood pressure elevated. And remember, they don't respond like the standard trauma patient. Normally, if they start losing blood pressure, their heart rate goes up. They start getting pale. They start the vascular squeeze. The liver dumps. Remember, these are all impaired functions in the elderly patient. And again, usually your biggest indicator of shock is going to be the change in the mental status of that patient. Okay. Again, abuse, again, the patient that gets physically abused or psychologically abused, unexplained traumas, and again, usually it's somebody that it's done by somebody that actually known, and usually there's some sort of dementia also present. And unfortunately, they may not be the problem might be with the family not being able to cope with the current situation that's going on. Again, obtain a family history with this. Check for the inconsistencies. Again, don't confront the family. It's not going to solve anything. Okay, law enforcement really needs to know about this. Governmental authorities, and again, any suspicion of that, again, you are obligated under Florida law to report that. Okay. Cardiovascular considerations for the trauma patients. Remember, They don't recover. We talked about that just a minute ago. Again, they don't have the compensating mechanisms, okay? But just watch your fluid administration on these folks. Yes, you can overload them pretty quick, all right? If you got respiratory problems, by the way, don't forget that a lot of these folks have dentures, and they're really good at obstructing an airway, okay? So COPDs, again, don't forget you've got underlying conditions that's going to impair us from ventilating the patient properly. It will throw off their acid-base balance pretty quick, and again, their kidneys shut down almost immediately. And remember that their cardiac reserves, and usually the elderly patient, it's not really there like they are in the younger patient. Okay, it's very easy to tear their skin, and the physical deformities could also throw us off because are these a normal or is this an abnormal situation with them? And again, remember, these guys are very quick to go hypothermic on us. So again, the blanket is your friend in this case, okay? Strip them down. A happy trauma patient is a naked trauma patient, but then throw the blanket on top of these poor little cold little ladies, okay? So, again, by the way, little hint here. Oh, that's a femur fracture break. No, this is a hip fracture, okay? If it's a femur fracture, it's down here. This is a hip fracture. The head of the femur is a hip fracture, all right? So again, there's all kinds of different hip fractures that you can actually get here. You can get the hip fractures actually that split into this region as well. Okay, so again, orthopedic injuries, again, immobilize as appropriate. And remember that they might have been on the floor for a very long period of time, okay? And so they can become hypothermic very quickly. They can be dehydrated very quickly as well, okay? And burns, again, remember, they have a hard time feeling it. So the burn is probably going to be deeper than what you expect, and they're very slow to heal, and a definite complication with that, all right? And they do have an increased risk of shock because of that particular situation. Head and spinal injuries, again, they may develop slowly. If they bump their head and they're on a blood thinner, they go to get CAT scanned, okay? They can have a degeneration of the vertebral joints, so they are susceptible to having neurological problems happen because of that, okay? In short, again, older people, they don't bounce back like the younger people do, and we have to keep that in our thoughts as we're treating and assessing these patients, okay? Understand that our medicines work a little bit differently on our elderly patients. Keep that in the back of your head. Keep this in mind, okay? Remember that they don't heal as fast. They don't have the compensating mechanisms. These are all things that we have to remember when we're dealing with our older patients, okay? And don't jump to conclusions. My former paramedic student Ed, who I love very dearly, the guy's 82 going, the guy was 67 when he graduated fire school, okay? The guy was a beast, all right? So, but we say, well, he's elderly. Well, yeah, but he's in extremely good shape. He passed paramedic school at the age of 81. Okay, come on, guys. I mean, so again, it's strictly based upon what their condition is, all right? And again, they're more susceptible to, and I say that also because he ended up developing a urinary tract infection, was out for 2 weeks, and had to actually be hospitalized. We had to augment. I had to actually do coursework for him. We actually did the coursework with him he was one of our first Zoomers, truth be known. So, which was, by the way, a really interesting thing to happen because there's this 81-year-old guy doing Zoom. It was a rather interesting thing. So again, don't forget about abuse. Make sure notify your proper authorities. Again, that is part of the law here in the state of Florida. But again, yeah, you definitely need to make sure. And if let them investigate it. Let them do the tough stuff. Okay. So again, keep this in mind when you're working on these patients and you're engaging in these treatment plans. All right, guys.